Hello, everyone, and welcome to this edition of the Taking Control of Your Diabetes podcast. I am one of your hosts, Dr. Jeremy Pettus, joined as always by my good friend and colleague,
Steve Edelman.
Dr. Steve Edelman, in fact. And if you're just tuning in, Steve and I are both doctors. We're endocrinologists at the University of California, San Diego, where we do research, we see patients. We were both diagnosed with type 1 diabetes at the age of 15, Steve 20 years before me. And Steve started taking control of your diabetes now almost exactly 30 years ago. We're actually celebrating our 30th anniversary with Fundraiser coming up soon, which is going to be a raging good time, actually. So I'm excited about that. But anyways.
Thank you, Jerry.
This podcast is a part of a two-part series. We're going to do top 10 tips for people living with type 1 diabetes. That's this one that I'm going to kind of run. And then we're going to do top 10 tips for people with type 2 diabetes that Steve's going to run. So Steve and I were both tasked with coming up with 10 tips to give people, in this case, type 1 diabetes. So I did all 10 of these tips, and Steve has never seen them before. And likewise, I have never seen the type 2 things before. So, what comments Steve has and vice versa are going to be like kind of the real comments as we go through this. So just to kind of set the stage, this is globally, I approach this as 10 things I wish I could kind of tell everybody with type 1 diabetes. And there's definitely like a medical slant to it in terms of, health and things like that. But there's some like overall mental health things as well. So it's kind of a comprehensive list. So without further ado, and in no particular order, let's get to these tips. So tip number 1 is just to kind of level set for everybody out there living with type 1 diabetes. And it says, we all get high and we all get low. So what I mean by that is this is a very difficult disease. And especially, hopefully you have a CGM. You're literally looking at your blood sugars all the time. You're seeing when you're quote unquote failing, your blood sugars go high, they go low. I always say you eat, your blood sugars go high. You take a rage bolus because you're pissed off, your blood sugars are high. Then you go low and you have to stuff your face and you just kind of bounce all over the place. And the point of this tip is that a large part of that is type 1 diabetes, and there has to be some acceptance of that. Now, I'm going to get into that. We want to control our blood sugar as best that we can, but nobody's perfect. Nobody has a completely flat blood sugar. Steve and I get high and low all the time. Steve, way more than me. He's a mess. But it happens to everybody.
Jeremy gets high all the time. I might get low, but
So any comments about this tip?
yeah, I think what you're saying is people should not expect to be perfect all the time.
Yeah.
And type 1 diabetes is hard.
Mm-hmm.
And even though we have, CGMs and pumps that talk to them, we still give insulin in kind of a primitive way in the subcutaneous tissue. It's just unpredictable. And people can drive themselves crazy, and they can drive the people around them crazy as well. So just be accepting.
Yeah. And really the overall goal, I would say, of all of this is people want, kind of good blood sugar control, whatever that is. And we don't want to work so hard. We don't want to worry about it. So tip 1 is about the kind of the mental health side of this, is that you're going to have some highs, you're going to have some lows, and that is okay. I always say too, the only time you have a completely flat blood sugar is when, Steve?
You're dead.
When you're dead. And you don't want to be dead. So if you're not dead, you're going to have some bounce in your blood sugar. So that brings me to tip number 2, though, is that we can't just, let our blood sugars go willy-nilly all the time. So goal number 2 is know your goals. And what I mean by that is we all kind of know, we want to keep our A1C generally less than 7, but we have very specific metrics too for what is adequate control or ideal control for people with type 1 diabetes. And in general, we want your time in range, your time between 70 and 180, to be above 70%. And then we want to minimize the time that you're spending hypoglycemic. Now, I say this because a lot of times people will know this, but I have patients that come in and they'll say, my time in range is 75%, it's 80%, but I just, I need to do better. And it's kind of like, well, why? I think there is this pursuit of perfection sometimes, and we didn't pull these numbers out of our butt as endocrinologists. We know that if you keep your A1C less than 7, you keep your time in range above 70%, you're going to live a very long, very healthy life. And, so know those goals, and I'll come to kind of what to do about that afterwards. But I think this is an important step.
Yeah. The only thing I'll add to that, Jeremy, is when you think about it, every percent represents 15 minutes. And I've learned this from you. 70% really equates to an A1C of 7, and that's a great goal. But it allows us to be out of range 7.5 hours a day. And think that sort of relates to your first tip, is that even the experts that put up these high goals realize you cannot be in range 100% of the time. I mean, you and I have had days like that when we were on our deathbed, but we came back to life.
So all right. So know your goals. That's tip number 2, which brings me to tip number 3, which is you got to celebrate the wins. So if you are meeting your goals, if overall your time in range is over 70%, your A1C is where you want it. Not necessarily your A1C is less than 7, but maybe it's going in the right direction. You've went from 10 to 9 to 8. Celebrate those wins, because guess what? Like, we need something to celebrate. I always say with diabetes, our ultimate goal is what? It's for nothing to happen. We want to get through the day without going high, without going low, without having problems with our eyes or whatever it might be. And that's an impossible situation to obtain. You can't achieve nothingness. So you got to celebrate when you do win. And I have some examples here. Maybe it's just you nailed a bolus. You came up against a burrito you've never seen before, but you got you guessed the carbs slightly right, and you didn't, you kept it lower than 180. Maybe just waking up with a good blood sugar, or pulling off exercise. You didn't go high or low during exercise. You had a good eye exam. Doesn't necessarily mean no complications, but maybe if you do have complications, they're stable. I hate getting my eyes dilated. I hate it. And so, I really kind of put that off and just trying to celebrate when you go in and maybe you get some good news. A no-hitter we mentioned. Here's a good one. Correcting a super high blood sugar without going low. That's kind of hard to do. So maybe you were 300, you took a bunch of insulin. Instead of going to, 50, you just came in for a smooth landing.
Yeah, take a Frezza.
And then, I have here, I texted our friend Leslie Island, who's an endocrinologist, and she said, like I said, I would celebrate the victories, specifically the small ones. Example, I perfectly bolus for a s'more a few weeks ago, and I felt like a boss. So stuff like that. And this sounds cheesy, but actually do it. Pat yourself on the back. Hey, I did a good job, because people generally don't tell you that. You're doing a good job. All this kind of work that you're putting into your diabetes, there's times it actually goes well. Celebrate it.
Yeah, you know what? As patients, as we all are patients, we all have our doctors. It seems like we focus in on the bad things.
For sure.
Like, what do you think about? I messed up my blood sugar the other day when I forgot to bolus. And I think what you're saying is that we should focus on the good.
Yeah.
And forget the bad. but I know you love to celebrate, and is that why you're so high all the time?
Oh my gosh.
You celebrate every good thing.
Yeah, it's a different kind of high, Steve. All right, so I have this thing here that just says, I am healthy. And I gave this talk in person, I think at the one conference years ago, and I made everybody say the words, I am healthy. Because with type 1 diabetes, a lot of times people think, I'm sick, I'm damaged, I'm going to die, my eyes are going to go bad, my kidneys are going to fail. Those things don't have to happen. And I think I have at the end here that people with type 1 diabetes are living longer than even people without diabetes. So saying, I am healthy, that's another way of kind of celebrating a win. You're doing the work, you're hanging in there with type 1 diabetes, which again, sucks. Type 1 is really hard.
Yeah, and we've spoken to many crowds and on several videos that people with type 1 are living as long as those without.
Yeah.
And all you need to do is take care of those basic goals. And so you do get rewarded for all the hard work.
Yeah. Steve has a big birthday coming up. I won't say how old, but it's got a 0 behind it, and we're going to celebrate that too. So type 1s are living longer and longer, buddy.
You make me. They are. They are. I never thought I would make it this to this age. So yeah. I hear you.
Tip number 4. Steve loves this one. Stockpile. Become a hoarder. Stockpile everything. So get extra sensors, get extra insulin, get, extra infusion sets. Set your refills for insulin on like auto refill. You can have your provider. This is a very normal thing to do. Write that you use more insulin than you actually do. So say you take up to 100 units in your pump per day, because a lot of that can be wasted. You just don't want to be running out of stuff. There's nothing worse than being in the middle of something, anything, and your CGM falls out and you don't have one nearby. Well, guess what? You got to go home. Maybe you have to go to the pharmacy. That can really ruin your day.
Call Steve, ruin his day.
Call Steve. That's my number one thing that I do, actually. And those are the times that I think I'm really mad about having diabetes. When I feel like something goes wrong and I don't have the stuff to triage it. Now I got to go do whatever. So put insulin in your fridge at home, at work. Put, extra sensors if you can. Stockpile those as much as you can, because we need our stuff.
Yeah, and I think people should know that you don't have to wait till the exact month is over or 90 days over to ask for a refill. Mm-hmm. They give people a leeway. So mark in your calendar the second you're eligible. In fact, even if you called it in too early, the pharmacist will say, oh, we'll send it out in a day. And that way you have the extra amount of time, the extra pills. And I think the biggest hassle people are complaining about these days is that if their sensor goes out, like if you have 3 Dexcoms, for example, for a month, you lose one, you're down to 20 days.
It is annoying because you used to be able to restart them and you could milk like a sensor for a month if you wanted to. You can't really do that anymore. But so you got to call, when you've lost one, and get, those refilled, because you don't want to have kind of gaps in your sensors.
And this is a off-label tip, but, most endocrinologists will have samples in their office of CGMs. And so if you're on a Libre, you can ask for 1 or 2 if you have them, or a Dexcom. And we have them in our office at UCSD.
We do, and it's interesting because we're not allowed to have like medication samples at an academic university, so we don't have any pills, but we're allowed to get technology. So we have sensors, we actually have meters and things like that. So don't feel sheepish for saying, hey, do you have any extra sensors? I'm running low or whatever it might be. Don't abuse the system, but know that that's an option too.
Great idea.
Yeah. All right. So tip number 5, eating low-carb-ish. And, why I have this here is that in general, nobody knows how to count carbs. Like, it's really difficult. But I know what a carb is. So, I can limit them. That's a lot easier. You give me a giant bowl of rice. I have no idea how many carbs are in that. If you give me a slice of bread, I'm going to get a lot more accurate. So we try to limit my carb intake. And I know you do, Steve, too.
Yep.
I don't have like a set number in terms of carbs that I aim for each meal. But man, your blood sugars are going to be a lot easier if, you lettuce wrap your burger, you avoid the fries, or at least kind of limit them.
Small fries.
Small fry. I have a picture of bacon and eggs here. Nothing wrong with that for breakfast. No carbs there. And I also have a big old body of Blanton's whiskey, which you and I like. Guess what? Hard alcohol, 0 carbs. Good to know. Chicken, vegetables, these kinds of things. We are not low carb zealots. We like carbs.
Yep.
But the less carbs you eat, it's just easier to predict in terms of how much insulin you need, and your blood sugars are just going to be a little smoother for sure.
Yeah, that just reminds me of our donut challenge we had. Jeremy and I ate 3 donuts in 20 minutes, and we kept our blood sugars in range for 2 hours.
Yeah.
But it took a lot of work.
It did.
Between running up the steps, taking a Freza, pre-bolusing, post-bolusing. So yeah, you're right, Jeremy. And I think low-ish makes so much common sense.
Yeah.
You cannot say no carbs or extremely low carbs, because carbs are part of our life,
They're delicious.
our lifestyle.
They're delicious. All right. So the most important thing about that donut challenge was that I beat Steve. So going on to tip number 6. So tip number 6 is sometimes you have to say F it. And what do I mean by that? Well, what I mean is that sometimes your blood sugars are going to go high and you just have to say F it. So I have a picture here. The other day, my blood sugar actually went out. I had some pizza, I had some beer. My blood sugar was 250. I said, F it, and I had a donut, because you know what? Sometimes you just got to let it roll off your back. Now, we don't do this all the time, but the reason I say this is because sometimes patients will say, gosh, every time my blood sugar goes above 250, is that doing damage to my eyes? And it doesn't work like that. It really is long, sustained, high blood sugars. So if you get these, spikes, which we all do, correct your blood sugar, try to bring it down safely back into range, and get on with your day. Don't hang on to that, because the important part is keeping in the fight, kind of.
Yeah, and I think it's just important to remember that relates to your very first tip. Shit happens, and you got to be able to accept that and grow with it. And if you feel like screaming at the top of your lungs, just do it.
Yeah.
And so it's one of these days when everyone has islet cell transplantation, these rules will be worth shit.
Well, and I have, there's two ways to say F it. There's in like real time, you didn't know what was going on, you ate a donut, your blood sugars were high, like I said, you say F it, you go about your business. The other one is the pre-planned F it, which is, hey, I'm going on vacation, next week, or I'm going to be away this weekend, or I'm going to be at a conference eating weird food and staying up late. I know my blood sugars are going to be not ideal, and I'm going to have to be okay with that. It's very difficult to say, like, I'm going to go outside of my routine, I'm going to have fun on vacation and expect perfect blood sugars. If that happens, great, but give yourself some grace that some small periods of less than ideal control is okay.
That's much better than a surprise effort when you did everything to prevent the effort. So, no, I love that idea. It's a pre-planned effort.
Yeah. We should pre-plan an effort real soon. Yeah. So, and by the way, to that point, we go out to pasta dinners. I mean, we do these things like, we abandon these rules, from time to time. We do our pre-planned efforts. We probably don't sit down and say that's what we're doing, but we do. We do it together. Yeah.
And we all do our best. I mean, we sit down to a pasta dinner. We do the pre-bolus. We carry our Frezza with us, and sometimes we do it. And if we don't, it's not the end of the world, and it probably isn't too far over our upper limit.
All right, tip number 7, that's definitely more of a medical one. So when you see your provider, don't forget about your non-blood sugar issues. So what frequently happens when a type 1 comes in to see us is we pour over the CGM and what, pump they're doing and their carb ratios and things like that. And then they walk out the door and I look at their chart and say, man, their cholesterol was actually high, their blood pressure was high. We didn't talk about that at all because we get hyper-focused on blood sugars. Super important, but make sure at every visit you're talking about your blood pressure. Know your goal. It's usually less than 130/80. Know what your cholesterol is, specifically your LDL. Usually want that less than 70. And guess what? Treating blood pressure and cholesterol is easy peasy. They're generic once-a-day medications that are very effective, generally very well tolerated, don't have side effects. What a difference than all the work we put into our blood sugars, right? We still got to control our blood sugars, but if you have an A1C of 6 and your cholesterol and blood pressure are through the roof, you're screwed. So don't forget these things. Sometimes people will say, well, my blood sugar is great, like I'm going to live forever. Not if you're ignoring these other things.
Yeah, time with your doctor is limited. So do your homework ahead of time. If your cholesterol level's under control, you don't even have to bring it up. If you have a blood pressure cuff at home, you don't have to spend any time of your, very precious few moments with your doctor. So, but if you have issues, just like you said, Jeremy, beyond glucose control, bring it up.
Yeah.
But the more homework you do, the more time you can focus in on your main problems with your visit.
And then I would tell everybody to kind of put on their calendar. Sometimes people will say, like, every January is I know that I need to get my eyes done, get them dilated. I just said how I hate, doing that. At least, every year. Sometimes we'll do every 2 years if people have, ideal control and no issues. Get your blood work done at least every year. That'll have your cholesterol on it, and then your blood pressure every time you kind of go in. So just kind of have this maintenance program. And Steve, you've done like these great diabetes warranty programs. And guess what? If you do it, we just said that people are living longer with type 1 diabetes. And a big reason is because of this, that you're going in because you have diabetes, but they catch your cholesterol earlier than they might have, or your blood pressure, or you're on top of your diet, or you're exercising more than you otherwise would have. So take care of your blood sugars, but remember this other stuff too.
Yeah, I'd get a home blood pressure cuff. Don't ever when you go into the doctor, you're running, you're late. The doctor's ex-wife is the one that collects your copay. Your blood pressure's through the roof. We want multiple values at home, and if it's always normal, you can space out the number of times you do it.
Mm-hmm. All right, tip number 8. So it says, but what about my blood sugars, Jeremy? So we haven't really given any specific tips to blood sugars. So this one is kind of some rapid fire blood sugar tips for people with type 1 diabetes. Number 1, no brainer. Use a continuous glucose monitor. In 2025, yeah, like we still have to say this though, right?
Okay.
That there's still a number of people that aren't using it. But to me, this is like just a must for everybody with type 1 diabetes. You can get these generally covered. But I do say, and set the alarms right. So talk about that, Steve. That's your thing.
Yeah. Most doctors will never even bring up where you should set your alerts and alarms. Everyone should set their low alert at 80, maybe 70 if you're really sensitive. However, the upper alert is extremely important. It tells you hey, my blood sugar is above the range that I want it to be. I'm going to look at that number, look at the trend arrow, and decide if you want to do a correction or not. So when you see a patient with high blood sugars across the board on their download, they're about averaging 200, 220 all day long. Guess what? Their upper alert is set at 250. And if you want to see me lose my shit in clinic, come in there and set your alert at 250. And I understand there's alarm fatigue. So you have to do a lot of things. You can set your upper alert a little lower during the day, a second time frame at night so you don't get bugged. Pick a sound that doesn't bug you, like the factory sound. There's some nicer sounds that you can do. But people don't realize this will help you lower your time in range 5 to 10%.
Increase your time in range,
Yeah.
more time in range. So yeah. I mean, I always say that a CGM alarm should be a call to action.
Yes.
So when it goes off, you got to do something. If you find that it's going off and you're ignoring it, then it's not at the right level. So, typically we start at 180, but then, you can tighten it up down to 170, 160 if you want. And you got to find that balance between like my control is getting better and I'm not losing my mind with all these alerts going off all the time.
What's your set at?
So right now mine's at actually 180. Because usually I find that like my system right now is actually doing a pretty good job correcting me up until then.
Got it.
And if I take a bolus a little bit earlier, sometimes I go low. So anyways.
No, that's a great point.
Yeah.
So it depends what system you're on.
Yeah. Which is point number 2 of tip 8, which is, get on a hybrid closed loop system. We have so many of these pumps now. We've done multiple podcasts on it. Still, there's people that are resistant to going on these systems, but they're getting better and better. I didn't used to kind of push pumps on people, but now it's kind of the first thing I do if somebody's not on a pump. You got to get on one of these systems. If you are on one of the systems, educate yourself on the different options because they're constantly changing, evolving. What systems what CGMs they work with. That's been a huge advance, that you're not locked into one particular CGM or the other. Providers have a very difficult time keeping up to date with this. So educate yourself on the different systems. We have all kinds of resources on this podcast, on our website, etc.
Yeah, that's the bottom line. And I'm like you, Jeremy. I used to say, pump, MDI, just take your pick. But I have to say, there's no way your insulin pen can communicate with your CGM device. Right. However, let me just say, for all the MDI users out there, you can do extremely well, and having a pump may not fit in your lifestyle, and you shouldn't feel guilty or bad about it.
Totally. Good point, Steve. If you're doing really well on shots, then if it's not broke, don't fix it. But if you're still having highs, lows, it's something to consider.
Yep.
All right. Point number 3 within tip 8. Pre-bolus.
We'll be done in about 4 hours, Jeremy.
Pre-bolus for every meal and snack. So we usually say 10, 20 minutes before you eat. Insulin works just really, really slow. So you have to tell your system that you're eating essentially. What I do, honestly, is I enter 30 grams of carbs 20 minutes before I eat any meal. And I just start there because I know I'm going to eat at least that much. I get some insulin into my system. It's kind of a foolproof plan. Anybody can do that. And then when I sit down to eat, if I eat more than that, then I'll kind of enter it as I go. And I find that system works really well to kind of help avoid the post-meal spikes that we all get.
Yep. I put my insulin to carb ratio at 1 to 10. I just picked that number because I know how much insulin I need for meals that I've been eating for 30 years. So if I say I need 5 units, I put in 50 grams. So I do it in reverse. And that works pretty well for me. Everyone's got their own method.
Yeah. And then it just says consider adding Afrezza to your regimen. So we've talked a lot about Afrezza too. It's inhaled insulin. It works very quickly. You can add it to your pump. You can use it with MDI. There's lots of different ways to skin a at with Afrezza, and it's a nice tool to have.
That's
always.
8.5.
Yeah, it is. Thank you, Steve. So that was tip number 8 in conclusion. Now, tip number 9. This is an important one for Steve and I, is get a buddy. So what do I mean by that? Well, that's somebody else that has type 1 diabetes. So I'm lucky enough to have Steve, a good friend, who's a good friend, but also somebody that you can just call and bitch to, if you want to. There's a real camaraderie around having diabetes. So having that person can be so helpful. And I love my kids, my partner, but there's something special about somebody else that have type 1 diabetes. Now, you might not know somebody, online can be, a substitute, meeting people. Our one conference that we just had, we had, literally 700 people with type 1 diabetes in person. We do this every August. All kinds of diabetes buddies were kind of made that conference. And these people carry these relationships honestly through the rest of their lives, and it can be really, really powerful.
Yeah, I would say search out for groups in your area. Call the Breakthrough T1D office. They may have several groups, online groups, and there's even dating systems for people with diabetes.
Yeah, and Steve's phone number is 619-555-867-5309. And the last tip, Steve, is tip number 10, and it says you are going to be okay. So it says here again, type 1 life expectancy is now longer than people without diabetes. So this disease really is a struggle. I always say that I think it's unique in terms of what we ask patients to do. Look at your blood sugar, make these calculations, take insulin. But if you don't get the dose right, guess what? You can go high. That causes problems. You can go low. That makes you feel like crap. And you got to do that over and over and over and over again. We don't do that with any other medical condition that I can think of. So it's no surprise that people struggle getting their blood sugars in control. Or even if they are in control, I always say people with an A1C of 6.5, they're not having a good time. They still have diabetes. They're doing a lot of work to get there. So this is just one of saying, kind of again, to give yourself some grace. It's going to be okay. If you're doing the work, people are living long, healthy lives and doing whatever they want.
Well said, Jeremy. There's never been a better time to have type 1. The technology is getting better. Other therapies for type 1 are going to be available. So I think things are looking up. Mm-hmm. And it's certainly different than when I got diabetes and I had bamboo insulin syringes and peeing on a stick.
Yeah.
So
when you slid off the tail of your brontosaurus into your stomach.
Things are, having type 1 is not a death sentence anymore.
So you love when I do this, but let's recap. Okay. So let's go through my top 10. Number 1, we all get high. We all get low. Number 2, set your goals. Know your blood sugar goals. Number 3, celebrate your victories. 4, become a hoarder. Stash your stuff everywhere. Number 5, eat low-carb-ish. Number 6, sometimes you have to say,
F it.
Mm-hmm. Number 7, don't forget about other stuff. Health maintenance, blood pressure, cholesterol, eyes, kidneys. Number 8, my laundry list of blood sugar tips where I hit about 10 things in number 8. Number 9 is get a Steve, get a diet buddy. And number 10, you're going to be okay. And I'll end with this very famous quote, type 1 diabetes is the best thing that ever happened to me. Said by me just now. And also I've said it before, but it's a very good quote. So with that, I hope you guys enjoyed our top 10. We're going to turn the page and record a type 2 one now. But this has been great. Thanks for doing this with me, Steve. And I do want to say, it does matter when you guys hit like or subscribe or follow us or leave comments. This is, for better or worse, the currency in this day and age in terms of getting sponsorship, etc. And we put this all out for free. So we just hope if you like it that you let us know.
Jeremy, you're the best diet buddy anybody could ever have.
Thanks, buddy.
I love you.
You're my second best, I would say. But yeah, I'm just kidding. Love you, buddy. Well, thanks for listening, everybody. And we will you'll hear us on the next one.